Hello, I am Dr. S.D. Gray, and I am an anesthesiologist in Denver, Colorado. The current pandemic crisis has created a lack of availability of masks for healthcare personnel. This has become a dire situation as many healthcare providers are going without masks or are reusing masks from patient to patient. Here in Denver, Colorado, we will run out soon. So I've been brainstorming ways in which to safely reuse masks while protecting us and our patients. This is using the data and resources that we have available to us. Now I realize that this process might seem ridiculous or crazy in a normal medical environment, but the times that we're living through are anything but normal. So this is the process. When you arrive at work, put on a head cover, clean head cover, and a clean mask. Now, this is a clean mask I had at home before this craziness started. Tie your mask as you normally would, while leaving some breathing room at the bottom. Then, take a clean sheet of sticky plastic wrap, such as Glad Press and Seal. Take this and cover your mask completely with it and stick it to your mask. Then take the ends and wrap them completely around your head, covering the straps in the back of your mask. Then take the bottom of the plastic wrap and wrap it underneath the edge of your mask, while leaving yourself again room to breathe. Now, I have worn this contraption around my house for an hour, and you can also do this. And it is no harder to breathe in than an N95 mask. When you have finished caring for your patient, well, obviously then you're going to don your other protective gear. When you've finished taking care of your patient with your dirty gloves, remove the plastic wrap, being careful not to touch your mask. Sometimes it's easier to have someone else help you with this. And then take your dirty gown, gloves, remove them, and throw them away. If this is the end of your day and the last patient you're taking care of, you can follow my next steps. Otherwise, repeat the application of the plastic wrap. So if this is the end of your day, hand sanitize and put on clean gloves, and then remove your mask. And remove your head cover. If you have a disposable head cover, throw it away. If you have a cloth head cover, also remove it and put both into a clean plastic bag. Then sanitize the outside of the plastic bag and take it home. Now, the current data that we have states that virus is undetectable on cardboard after 24 hours. I'm extrapolating that to paper and paper masks and hoping that it's true. More data on this would be really appreciated. So when you arrive home, take your mask out and hang it on a clothesline in a sunny, warm place with a metal plastic clip. Spray it lightly with diluted chlorine bleach and allow it to dry in this place for 2 to 3 days. Now, I've set up my clothesline inside because the current Colorado weather does not let me to set it up outside. However, I believe if you live in a warmer, sunnier place, you could set the clothesline up outside and it would be a much more efficient and safe process. Now, when you have let this sit for 2 to 3 days, you can remove it, put the metal clip in a diluted bleach solution, put the mask back into a clean plastic bag, and take it to work. I realize that this process requires us to have more than one mask available to us. My hope is that if we can start saving and reusing masks in this way, that we will all have a couple of masks that we can rotate. Also, I would like to say that this process could be made much more efficient in hospital facilities that have the ability to UV sterilize in a large area. The masks at the end of wearing could be UV sterilized and then reused, and we could each label our mask with our names that we could retrieve at the beginning of the workday. So to wrap this up, no pun intended, I would like to say that this process has not been approved by any governmental agency, any hospital administration, or really anyone for that matter. However, currently I believe that it is very dangerous for us all to go without masks and to reuse masks. So this is the best process that I could come up with. Take care of yourselves and stay safe out there. Our patients need us. Thank you.